Welcome to Shri Medical College. Today we will explore optometry and dry eye syndrome, causes, symptoms, and treatment options. Dry eye occurs when there aren't enough good tears produced to adequately keep the eye moist and healthy. Clear eyesight and a healthy cornea rely on tears to keep the eyes moist and lubricated. The elderly population unduly suffers from dry eye, which is a widespread and persistent issue. Each time you blink, tears spread across the cornea, a clear covering at the front of your eye. Tears serve many functions, including lubrication, infection prevention, removal of debris from the eye, and surface maintenance. Excess tears drain into the back of the nose through tiny ducts located in the inner corners of the eyelids. When tear production and drainage are out of whack, the result might be dry eyes. When tear production and drainage are out of whack, the result might be dry eyes. Dry eye sufferers have either inadequate tear production or low-quality tears. Several glands in and around the eyelids produce an insufficient amount of tears. Reduced tear production is common with advancing age, as a result of certain medical problems, or as a negative drug side effect. Tear volume can be reduced by environmental factors including wind and dry climates because of increased tear evaporation. Dry eye occurs when tear production drops below normal or when tears evaporate too quickly. Tears of a low quality. Oil, water, and mucus make up the three components that make up a tear. Every part serves to shield and nourish the cornea. The mucin layer evenly distributes the tears around the eye, while the oil layer helps keep the water layer from evaporating. Dry eye symptoms can occur if any of the three tear layers is defective, causing tears to evaporate too quickly or to not spread uniformly across the cornea. Some people have dry eyes as a normal consequence of becoming older. Dry eyes affect the vast majority of adults over 65. Due to hormonal changes seen during pregnancy, oral contraceptive usage, and menopause, women are more likely to experience dry eye symptoms. Antihistamines, decongestants, blood pressure medications, and antidepressants are just some of the medications that might cause a decrease in tear production. Dry eye symptoms are more common in those with autoimmune diseases such as rheumatoid arthritis, diabetes, and thyroid disorders. Dry eyes can be brought on by a number of different conditions, including blepharitis, inflammation of the eye's surface, and the inward or outward twisting of the eyelids. Dry eye symptoms can be brought on by being exposed to smoke, wind, or a very dry climate, all of which enhance tear evaporation. Long amounts of screen time might cause eyes to dry out if the person staring at the screen doesn't blink frequently enough. Contact lens wear over an extended period of time has been linked to dry eye syndrome. Dry eyes can be a side effect of refractive eye surgery, including LASIK. In severe cases, dry eye can damage the cornea, which is responsible for clear eyesight. Itchy, gritty, scratchy, or burning eyes, a foreign body sensation, excessive watering, and blurred vision are among symptoms of dry eye. A thorough eye exam will help determine if you have dry eyes. It's possible that the following tests might be administered to determine the number and quality of tears generated by the eyes. Review of the patient's medical history to identify any underlying health conditions, drugs, or environmental variables that may be exacerbating the patient's dry eye symptoms. Inspection of the eye's exterior, including the lids and the movement of the eyelids, is performed. Examining the eyelids and cornea under strong illumination and close inspection. Examination of tear production and quality for anomalies. To better see the tear flow and to emphasize any changes to the outer surface of the eye due to insufficient tears, special dyes may be injected in the eyes. A doctor of optometry can diagnose dry eyes and recommend a course of therapy based on the results of a thorough examination. To alleviate dryness and pain and protect eye health, treatments for dry eyes try to restore or maintain normal tear production. An optometrist can provide treatment for persistent dry eyes to maintain ocular health, comfort, and vision quality. Over-the-counter artificial tear solutions, conserving tears, increasing tear production, and treating eyelid or eye surface inflammation are the main therapies for dry eyes. Over-the-counter artificial tear solutions are effective in treating mild symptoms of dry eyes. To augment your eye's natural tear production, you can use them as often as you like. It is recommended that artificial tear solutions without preservatives be used because these include fewer ingredients that can aggravate eye irritation. Dry eye sufferers who don't get improvement from using artificial tears alone may require further treatment. Maintaining the tear film for a longer period of time can alleviate dry eye problems. To achieve this, one must prevent tears from draining from the eyes. Small, reversible plugs made of silicone or gel-like material can be inserted into the tear ducts to prevent tears from draining. The tear ducts can be permanently closed with surgery. In any scenario, preventing dry eye symptoms requires maximizing the time that tears remain on the surface of the eye. Your optometrist can provide you with eye drops to stimulate tear production. Supplementing with omega-3 fatty acids has also shown some promise, resolving the underlying inflammation of the eyelids or ocular surface. In order to reduce inflammation on the surface of the eyes, an optometrist may suggest using eyelid cleaners, warm compressors, and massage of the lids. When reading or gazing at a screen for extended periods of time, remember to blink frequently. Wraparound sunglasses are ideal for outdoor use as they shield your eyes from the wind and sun, keeping them from drying out. Dry eye problems may improve for some people after taking nutritional supplements containing necessary fatty acids. If you suffer from dry eyes, you should talk to your doctor about trying out some nutritional supplements. Staying hydrated by drinking 8 to 10 glasses of water daily is recommended. Be sure to point car heaters away from your face to prevent air from getting sucked into your eyes. Keep away from places that are unusually dry, such as the desert, an airplane, or a high altitude. Join Shri Medical College's Bachelor of Vocation and Master of Vocations in Optometry and Ophthalmic Technology and take the first step toward a successful career in hospitals. We are here to assist you in launching your medical career as optometrist. Call us at 9968193009 for more information about our program or to submit an application right away. Shri Medical College, nurturing next generation of healthcare leaders and offers all paramedical, pharmacy, nursing and yoga sciences courses at competitive fee and helps in 100% placement assistance. Admission open. For more information, please visit our website shriramcollege.com and like, share, subscribe our YouTube channel Shri Medical College. Good luck, goodbye.